So the Smart Ward has been installed on a GEM ward, which stands for Geriatric Evaluation and Management. And these are a type of subacute ward that cares for older people. Older people in these settings have particular issues with deconditioning and functional decline. And a lot of that is related to the fact that they don't move around as much on a hospital ward as they do perhaps at home. So being able to capture the amount of physical activity that patients are doing in these settings is really important for helping to prevent deconditioning and functional decline. Another clinical use is understanding the amount of time that patients are spending in proximity to staff members. So we can look at how much time staff are spending with different types of patients. And by using that information, we can have a better understanding of what types of patients are likely to use the most amount of staff time so that patients can be more fairly allocated to staff. So it really helps with staff workflows as well.
So essentially what happens is the patient wears the device around a wristband, and it's put on their arm in a very non-obtrusive way, and the information is collected in real time via antennas on the floor. That information is transmitted and it's put in the cloud. And from our standpoint, there is an API that's able to pull that data on a scheduled basis in whatever interval that we need. And then we can take that data, store it in an anonymized way in a database, and we can use that to perform analytics and hopefully contribute to better patient outcomes in the future.
So one of the main rationales for choosing the sensors is that the environment needed to be ultra low touch and low invasive to the users. So things like the wearables need to almost feel like they're not being there. The sensors on the roof need to almost look like they're not there. Because at the end of the day, it is a hospital, but we also want it to not feel crowded and cluttered in the airspace.
At the Flinders ward, patients wear the care tracker, a custom device combining a BLE angle of arrival beacon with posture and motion sensors. Signals from the trackers are captured by the BLE AOA gateways and processed at the Edge Location Services engine, achieving centimeters level accuracy. This allows clinicians to measure exact location within the ward, gait speed and step counts for mobility tracking, posture detection including laying, sitting and standing, fall detection for immediate safety alerts.
So this technology will be integrated with a whole range of different technological devices that are being installed on the Smart Ward. So for example, we're going to have information on patient movement and location from the Outcome X solution, but we're also collecting information on environmental conditions. All of that information will be linked in our Smart Ward database, where it will be integrated with the patient management system, or IPM. So we'll automatically be able to assign patient movement data to a patient's admission. From there, our plan is to link the data from the Smart Ward database with our National Centre for Healthy Ageing, which contains a number of important clinical data sets. And by linking all of that data together, we can then use the data for research purposes and build up a much better picture of what happens to a patient throughout their journey through a hospital.